I'm going to start.
Yes. Okay. Hi, everyone, and welcome to HealCycle's first webinar called Discover Your Hormonal Harmony. I'm going to talk a little bit about what HealCycle is and what we're doing, and then get started with the webinar itself. So let me quickly share my screen. So our focus as a company and initiative is improving women's mental and reproductive health. And specifically, the focus area is premenstrual mood disorders, like the most commonly heard one is PMS, and the most extreme form of that is PMDD or premenstrual dysphoric disorder. So that is our mission and vision. Starting with premenstrual mood disorders, we are developing a digital health solution and app um, for holistic tracking, as well as insights, personalized guidance, and resources. And our vision is that we add other women's health conditions to our platform to basically cater to women's health throughout their life. This is currently supported by Princeton University's Laboise Prize Fellowship, and Output and Reach Out Pitch Prize, and Google for Startups is our strategic growth partner. And you can also learn more by visiting the website, which is right here, HealCycle.com. So this is also like a brief overview of the different things that we are including on the platform, which is the mobile app, which will include journaling for both therapeutic purposes as well as symptom tracking. Then you get insights based on those symptoms. You can find our health hub, which has video modules and articles covering both mental health and physical health content, guided meditations and affirmations. And we include both care and community, which comes in the form of AI-driven features as well as human expertise. So a combination of the two. And let's move on. This is a sneak peek of what the app looks like, and we are very soon heading to our beta launch. So if you're interested in early access, do sign up on the website link. Coming to today's webinar, thank you so much for joining us. And thank you so much to Dr. Shabnam Das Kar for taking her time out to share her knowledge and expertise for free with all of us. Dr. Shabnam is an MD OBGYN. She's also a functional medicine doctor. She is a brain health coach and trained in Dr. Fogg's behavioral health, design techniques. So she's a tiny habits coach, which means that it is a process of modifying behaviors and behavior design. She is an international speaker, director of medical education at Live Younger in Canada, and she also advises multiple health tech startups. Thank you again, Dr. Kaur, for joining us today, and I let you take over from here.
Thank you. Thank you, Ananya. And Asta, would you like to add a few words? And then after that, we'll start.
Just sure. I'm just really excited to learn. It's really interesting to know more about the intersection of mental and reproductive health, and it would be great to learn more about how hormones affect you mentally and physically. So I'm glad so many people have tuned in. I hope there'll be interesting discussion at the end of this as well.
Okay. So welcome, everybody. I am Dr. Shabnam Kar. I'm living in Alberta in Canada now. So this is morning. The sun is not quite up here yet because this is winter. And thank you very much for encouraging two wonderful women as, as a femtech company startups. I get very excited about, when I find women doing things that are not quite, in my generation, was not quite considered the norm. And this is really wonderful. So how this will go is we have planned it in such a way that I'm going to speak for some time. And yes, I will have slides. I know slides bother some people, but without some visual aids, some of us don't learn well. And as you know, in medicine, some of the concepts are not, I can't, for example, you'll see, I can't explain a SPECT imaging, without without a slide. So And feel free to type your questions either in the Q&A box or in the chat. And so I will speak for some time. But before I start speaking, would anyone like to share what is it you're looking for today from this webinar? You're going to invest 45 minutes to 1 hour of your time. So what are you really looking for? If anyone wants to ask, I think you can raise your hand and I can probably unmute you, but you can post in the Q&A box or the chat box because we want to maintain your privacy. So we are going to share this recording later. So we want to be mindful of those things. So if anyone wants to share that these are the things I want to learn today. Okay. I don't see any raised hands or any questions yet. So I will go.
Okay, we have
There is one.
something in the
I'm looking
Q&A.
to understand my body better. Oh, I do hope we will give you a little bit of an explanation because, as you know, our bodies are extremely complex, and someone is curious about how hormones affect the body. Oh, before I start, I just want to clarify. Today, I'm not going to talk about men, mental health, and hormones. I'm only going to talk about women. So, men, please forgive us, but I know you have important women in your life. It could be your mother, daughter, sisters, or so colleagues, more important. Remember, I mean, for it's important for you all to understand. But today is going to be about women and not about men. And of course, in men, it matters too. How mental health is related to PCOD. Oh, we have lots of great questions. How to help rebalance my hormones naturally. Okay, I'm going to answer probably at the end of the presentation. Most of these questions will be answered. If they are not, just remind me. And Ananya and Astha, you're responsible for keeping me on track with time. I can easily go beyond our time limit. So, women, mental health, and hormones. The few things that, so I was an obstetrician gynecologist for many years in Mumbai, attached to hospitals. I, s- um, I moved into functional medicine, which is a different kind of medicine from the point of view of instead of looking at a patient system wise. So as an OBGY, I used to say I'm only below the belt. I only look at problems of tubes, ovaries, and the uterus and vagina and vulva. But there is our whole bodies are connected, interconnected. So we were never back then, we were never taught about how gut health or brain health or heart health, or there wasn't any conversation about mood and hormones at all, believe it or not. I hope the curriculum has changed now, but I'm not quite sure. Anyway, so to make it easy for medicine, we divided our body into different systems, but what we forgot is that all these systems actually talk to each other. So, and that was one major. Now, of course, being specialists is very important because there is only a limited capacity. Now, back then we didn't have AI, so we didn't have the other brain. Don't call it the second brain because the gut is supposed to be the second brain. So we have an entire huge amount of resources which we didn't have back then. It was humanly impossible for a person to know about the whole body in significant detail because our bodies are complex. And I think we should be very glad that our bodies are so complex. Otherwise, we would not have survived. How many is it? Is it 4 billion that the Earth has been around? We wouldn't have, no, humans have been there less. I'm getting it all mixed up. Anyway, how millions of years, we wouldn't have been around if our bodies had not been so complex. Now, when it comes to women and mental health or mental health in general, there is number one, there's a lot of stigma associated even today. And one of the biggest problems and this is still pervasive, there are a lot of people and many doctors, if they are not psychiatrists, and even some psychiatrists don't understand a lot of the nuances. Mental health problems are not just a problem of, someone is just thinking positive, because as I always say, I haven't met any person who wakes up in the morning and decides today I'm only going to think negative thoughts. So sometimes when people are dismissive, and these are well-meaning relatives and friends, could be even your parents, who'll tell you, oh, just like, sort of get over it, like think positive, as if like, thinking positive is so easy. There is a huge, of course, you should think positive. No one wants to have negative thoughts. But mental health conditions have somehow been relegated to this thing, along with living with higher body weight, as if people could just get over themselves and do a few things, sleep well, eat healthy food, depends on what you call healthy, and they don't spend time on their devices and blah blah blah, they should be good. Now, I'm here to tell you that is not true. And if you are here and you are interested, and if you are someone with any of these challenges, let me tell you, any mental health condition, particularly the more severe ones, actually need to be considered as any other things like hypertension, diabetes, stroke, heart disease. No one tells a person with hypertension, stroke, or heart disease that just think positive and everything will be fine. So that is one. The other important area is because women have been, dismissed and, misinformed, and so many things have happened. The very word hysteria, now, it got out of the DSM, that big DSM criteria which psychiatrists use for mental health diagnosis, and I'll come to that very soon. It went from that in the year, I think it was 1980. Now, I know many of you were born after that, but it's like I was in high school at that time, so not a long time ago. And what was thought is it was mental health and women. Women were supposed to be the weaker sex. They would have these, I'm sure, I don't know whether y'all have read these books. We have read these books where the woman is supposed to have, like, she would just faint and they give her smelling salts. So back then it was thought that the woman had a wandering uterus. Can you imagine? And if the uterus wandered nearer the head end, they were supposed to take smelling salts, I think. And if the uterus was nearer the other end, then you were supposed to give them, I don't know, some vaginal, I think some nice, wonderful smelling stuff. Women are supposed to sit on it, and heaven help you if you got the ends wrong. But anyway, we have moved away from that. There are no wandering uteri anymore. So going back to mental health, how is a mental health diagnosis or mental health condition, whether it is depression, or anxiety or panic, it's basically based on mostly symptoms. So unlike other specialties, for example, no one is going to base a diagnosis of diabetes or hypertension based on symptoms. Hypertension, very often there are no symptoms, and that is why it's called a silent killer. So there are no other specialty diagnoses any illnesses based only on symptoms, versus in psychiatry, it's a long list of symptoms. If you, say yes to blah, 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 then you are considered X. And Ananya mentioned about PMDD. So uh, these PMDD is again, I'll come a little bit to it because in the interest of time, I won't do a deep dive, because if you don't have PMDD, it may not be important to you. But just remember that there are 150 symptoms of PMDD. So irritability, mood swings, fatigue, whole bunch of things. But the diagnosis of PMDD is made when it happens in relation to the menstrual cycle. So you have XYZ symptoms today, and that is the day you go to the doctor and you say, I've been experiencing these for a while. The doctor makes a diagnosis based on those symptoms, usually, and again, I'm sure things will change now. Lab tests are perhaps ordered. Most of the time, I think they are ordered, but no one actually bases a psychiatric diagnosis. Like, there is no one test for, let us say, depression, or one test for even things like more severe conditions like schizophrenia or bipolar, or these are mostly symptom based. And so far it has worked. But today I'll also share some, because I know there are many people in the audience today, and both of you are here, that probably we have to start, not probably, it's high time we started looking at mental health diagnosis in a different way. It is possible to do certain imaging. So I have a certification from Dr. Daniel Amen's clinic in the US. He uses SPECT imaging. So I will just start with my slides. And okay, can you all no? Can you all see my slide? So
Yes, we
this
can
is
see
what,
it.
okay, this is what I have already talked about this, that in functional medicine, we look at any health condition as a conglomerate of many different things that happen in the body. Everything is connected to everything else. So yes, it's like a matrix. And today we are only going to talk about, some part of hormones, not everything. But what I want you to understand is your health is much more than just being, only your hormones. You have PCOS or you have irregular cycles, and that's the only problem you have. No, it is related to all these different things. And I obviously won't have time to go over all of them. Long COVID is something that has come up recently, obviously, because COVID is fairly new. And this is something a lot of doctors may not be aware, even people may not be aware. So, long COVID is there are about 200 different symptoms. Some of them are mental health symptoms where people have experienced these sometimes the symptoms change. Like today they may have palpitations and extreme fatigue. Tomorrow they have more of brain fog or some panic attacks or palpitations or something else. So the symptoms keep changing and they persist for a period of, I think the last definition the experts agreed to was 3 months after a COVID infection. And people have had these problems for, it's been more than 2 3 years now. Some of them have not been able to work even. So long COVID is something we need to remember because the symptoms are so varied. So someone who comes up with new symptoms after a COVID infection, we do have to keep in mind. So before all this, I will go, two of the areas I'm going to focus more on today is hormones and food. These are the most important ones for today's discussion. So when we talk about, hormones, brain, and mental health, in functional medicine, we consider mental health as brain health. And, is it the same as mind? I don't know because the definition of mind is a little difficult. But yes, what happens in the brain is what impacts mental health to a great extent. Of course, it's not the only thing. I'm sure many of you have heard about all these, is it a neurotransmitter imbalance? As you probably know, that theory has been debunked. It's not an imbalance of the neurotransmitters only, serotonin and dopamine and GABA and all these. They are important. But what is happening in the brain, we don't really have an easy way to know because we are not doing a spinal tap for every patient. We're not, taking out a bit of the brain fluid from the, back and analyzing it for neurotransmitters. And even if we did, that still wouldn't tell us what's going on in the brain. But hormones are also extremely important. Now, in this list, you can see that there are 10 hormones. So when people talk about hormonal balance, which hormones are they really talking about? And the good news is, I'm not going to talk about all the hormones today because y'all would have been here until kingdom come. I am only going to talk about insulin because basically my goal is to give you things that you can implement yourself. Yes, you will need the help of experts, but there are things that your experts cannot always help you with. One of the big ones being your food. So in thyroid, cortisol, estrogens, all these progesterone, DHEA, all of them are important. Pregnenolone, probably some of you have never heard of that hormone before, but that is considered the mother hormone. So all these other hormones, you directly cannot do a whole lot of things. Yes, you can help with your symptoms by managing your lifestyle better, but insulin is one hormone which you can impact by things you do or don't do. So I was talking about SPECT scanning. Hypothyroidism, as you know, thyroid has a huge impact on brain health and mental health, besides a whole lot of other things. This is a healthy brain scan. So SPECT scanning is it's a special type of scanning. So these are not actual holes in the brain. These are energy levels. And you don't need to be an expert to see that the two brains look different on a SPECT scanning. This is a patient with premenstrual dysphoric disorder, PMDD. As you can see, this was the worst time of her cycle. She had all these activations in many different areas. And again, these are not holes in the brain. These are areas of activation. best time of her cycle. She is much more calmer. And so when someone says that, oh, this is not really a true disease, true diagnosis, well, you can tell them here you can see it on a SPECT scan. And when people say, it's all in your head, well, it is. It is in the brain. So what happens during the menstrual cycle? Now, women have these cycles, and I assume they're mostly women in the audience. And if you're a man, you know that this is what a normal cycle is supposed to look like. Now, newer studies, which again Ananya and Astha, y'all are developing an app. So when you start tracking symptoms on the app, you'll realize ovulation is not necessarily on day 14. It is anything between day 11 to day 16. I think one of the recent studies came up with that, and that is new information. When I was in med school, we didn't have that information. We were told ovulation is on day 14 of the cycle usually. So day 14 of the cycle, when after ovulation, you can see that the hormone level, so the blue one is progesterone, red is estrogen, FSH and LH. Again, I'm not going into all the physiological changes and what happens, and this one goes up and that one goes down. But important to remember is after ovulation, progesterone goes up. Progesterone is an extremely important hormone for the brain, and now they are looking at a derivative of progesterone called allopregnenolone. So a derivative of allopregnenolone called brexanolone is being used for depression, postnatal depression, that is depression after the baby is born. And what happens is during pregnancy, hormones change dramatically. There are very high levels of progesterone because the placenta produces, and the whole lot of changes happen in the body. And also there are very high levels of estrogen called estriol, E3. So there are three different kinds of estrogens. The most common one is E2, estradiol, and I won't go into all of that today, but remember that there are three different estrogens. So when we say estrogen, most of the time we mean the E2, which is the 400 different actions in the body that estrogens have. And E3 is the estrogen of pregnancy. During pregnancy, large amounts are made. And in fact, in some conditions like multiple sclerosis, they're looking at whether, because multiple sclerosis symptoms are gone during pregnancy in women, so they were looking at whether it can be used for the treatment. So this part is important to remember because every woman will not ovulate in every cycle, and particularly someone had a question about PCOS. In PCOS, and ovulation, that means the ovulation not happening is common, and that is one of the causes of infertility in such women. If there is no ovulation, this progesterone surge will not happen. And if you look at the cycle, sometimes there is no way to know whether you can still get a normal cycle, but not ovulate. So, and to know whether you're ovulating or not, there are different ways. One of the simpler ways is checking temperature. So I think now there are some devices, I'm not sure whether they're available in India yet. There is an FDA approved device to check temperature. And back in the days when I was an OBGY, I was not an infertility specialist, but I remember I used to ask patients to track. And women and men will do very difficult things when they are, trying for a pregnancy. And my wonderful patients would actually track temperature. I have never done it myself, but it is not an easy thing to do. And this was not a digital thermometer back then. These were those ones with the mercury where, it's very easy to get it wrong. But now there are better devices available to know whether a woman is ovulating. That is important for fertility more than anything else. So when I talk about insulin, just remember this: master your metabolism to master your health. And I'm going to make it sound a little more complicated by calling it carbohydrate insulin metabolism. So here I want to explain a little bit about what do I mean when I'm talking about mastering your metabolism, and insulin is the hormone that you can impact. So now when I say metabolism, many of you probably are familiar with the term. You understand what it sort of kind of means. Most of the time people think that I don't have a high metabolism, my metabolism is slow, that is why I have struggled with weight gain, I can't get rid of the weight in my body. Weight gain and living with a higher body weight is a different discussion. That's today I'm not going to get into that, because that itself can cause a whole lot of problems, because, and not because of, a woman feeling bad that she doesn't look the way she wants to, but there are a lot of uh, chemicals that are also released by fat cells called adipokines and cytokines, and those can cause problems as well. So when I talk about insulin, what I basically mean is insulin, as all of you probably know, is the most important hormone for maintaining normal blood glucose levels in the body. Now, blood glucose, our blood sugar, is more commonly, a lot of people call it sugar, but it's not technically correct. It's blood glucose that we're talking about. But what happens is when you eat carbohydrate containing food, so it's things that contain sugar and things that become sugar. So what are the things that become sugar? All the, a large number of Indian food, rice, poha, upma, sabudana in khichdi or vada, then dosa, idli, you name it. And I'm 100% sure most of you started your day with a carbohydrate today. So large amount of carbohydrate, what happens is, this is again a problem more so in South Asian, so people in India, Pakistan, Bangladesh, Sri Lanka, that our carbohydrate insulin metabolism gets affected very early. So sometimes insulin levels may be very high compared to what it should be for that age. And that in a lot of South Asians, in India, there are a lot of studies showing that it's happening in very young age. So by the time a woman is in her 20s, 30s, the insulin level may not, fasting insulin, I'm sure many of you read a lot of stuff online. Oh, did your doctor ask you to do a fasting insulin test? And if the doctor didn't, then the doctor is useless. Well, it's not quite true. A normal fasting insulin in insulin resistant population like Indians doesn't necessarily mean you don't have insulin resistance. There are different, what happens is the high insulin happened much earlier in life, in childhood, and that's why childhood obesity and all those things are big problems. By the time they are much older, a lot of the insulin has come down, and Indians, South Asians have a different problem with the, so the hormone insulin is made in the pancreas by the beta cells. So Indians lose beta cells much earlier, and that is not a good thing. That's why we are India is the diabetes capital of the world, the heart disease capital of the world. Heart disease, diabetes, all these chronic conditions come much earlier in Indians, at least 10 years before the rest of the first world countries and other populations. So many of you in the audience today, I don't know your age, but I assume most of you are young. You probably have hypertension and you don't know it, and you might even have insulin resistance and you don't know it. So insulin resistance is when the hormone insulin is not able to manage your blood glucose levels well. And it doesn't, the final thing that happens is usually type 2 diabetes. But even before your blood glucose levels, so how is diabetes diagnosed? Diabetes is diagnosed based on blood test where you blood glucose level is measured. It's above a certain threshold, and then they tell you, or they check the HbA1c, which is not a very good measure, and they'll tell you, oh, you have diabetes now. Or if you're a little below that, you're heading that way, you need to be careful. I don't know what being careful means, because most doctors don't have knowledge about lifestyle change and nutrition and food and any of that to tell you what to do. Some do, but they have, like me, they must have studied later. It was not a part of regular medical curriculum. So insulin resistance is when the hormone insulin is not able to manage your blood glucose levels for a given amount of carbohydrate you eat. And it doesn't necessarily mean your insulin levels are high at the time of diagnosis. They could be low because they were high many years ago when you were a child and you didn't know. But, this is a very highly simplified version of insulin resistance that I'm explaining. The other important thing to remember about insulin is what we call a fat fertilizer hormone. So if insulin carbohydrate metabolism is out of whack, what happens is our bodies end up retaining a lot of the fat, and most of the fat ends up around the belly. So if you look at a woman who thinks she is not overweight, and sometimes you'll find that the belly is protruding. So a better measure of whether someone has insulin resistance or not is simpler one is ideally your waist should be half your height, or you can measure your waist circumference. And sometimes you can actually, when it is quite obvious, you can see the belly protruding even when they're not pregnant. So belly fat is one of the big ones. What are the other ways you'll know you have insulin resistance? If you have fatty liver, if you have PCOS, if you had pregnancy diabetes, if your liver enzymes SGOT, SGPT are mildly raised, if you have primary hypertension, that is high blood pressure, not from kidney disease or any of the other conditions, the commonest variety of hypertension, and that is common in younger age group in India, particularly women with PCOS, and it's often missed. Then if you need extreme exercise to maintain your body composition, you struggle with maintaining weight loss, you have, your rest of your body looks kind of okay, but you have a protruding belly. These are the things that give you a clue whether you're dealing with insulin resistance. And insulin, so I'm sure many of you are wondering, when is she going to get to mental health and insulin resistance? So recently, there is an entire specialty called metabolic psychiatry. Stanford has a department. Dr. Shibani Sethi Dalai is heading that. So what they have found is insulin resistance. So basically, again, when I say insulin resistance, I basically mean your carbohydrate insulin metabolism. So I will use the terms metabolism and insulin resistance interchangeably because insulin resistance is not a term many people are aware of, including doctors. So when I say metabolism or insulin resistance or dysregulated blood glucose levels, they kind of mean the same thing. So this problem of insulin carbohydrate metabolism has been found to affect people living with mental health conditions. There was a time when it was thought that some medications, antipsychotic drugs, can raise blood glucose levels, but newer studies are showing that this is a problem very likely happens at the brain, in the brain, at the level of the brain. And also brain glucose hypometabolism. So this problem of brain glucose not working well in the brain is also a problem in conditions like Alzheimer's disease. Women going through the menopausal transition. Now, for women in the menopausal transition, obviously it's not a permanent thing. Otherwise, every woman would have dementia. But this is one of the reasons why there are more women with dementia than men. So your metabolism impacts everything in the body, whether it's your mood, your heart disease risk, PCOS, diabetes risk, your gut, your bone, everything is impacted. Brain health, your risk for dementia, everything is dependent on your carbohydrate insulin metabolism. And that is why it's very important to get a handle on that as soon as you can. So next I'm going to move to what you can do. Otherwise, I'm going to run out of time. So you can see this long list, which is connected to unhealthy carbohydrate insulin metabolism. I am probably adding new stuff to this list. So recently, colon cancer in younger men has become a big problem. And one of the things they found is it's because of their dysregulated metabolism. Breast cancer, not just a diagnosis, even those who have survived breast cancer, even in them, carbohydrate insulin metabolism impacts how long and how well they will live. And you can see this whole, since we're talking about mental health conditions today, all of these are included in unhealthy. And again, for simplification, I'm going to say unhealthy metabolism. In my world, we say, heart disease is diabetes of the blood vessels, PCOS is diabetes of the ovaries, fatty liver is diabetes of the liver, and Alzheimer's is considered to be type 3 diabetes, so it is diabetes of the brain. And mental health conditions are also, when we say diabetes, it is not technically correct. They have not crossed that threshold. But when I use the term diabetes, people actually take notice because most people are aware of diabetes. So all these different things are related to unhealthy carbohydrate insulin metabolism, and that is why it is so important to maintain your metabolism. Now, these are the 8 keys this is a framework I use to, have a patient consultation. I won't go over all of them, but You can see here, this is nothing very new. Probably the only added things here that many of you may not, it usually doesn't come top of your focus because people are not talking about them, is taking appropriate prescription medications. The operative word here is appropriate. People take a lot of inappropriate medications as well, and using supplements at therapeutic dosage and dosages that have shown benefits in at least some clinical studies. And today I'm not going to get into that in great detail, but nurturing meaningful relationships. What is your mindset? Do you think, your life is just going to be, you're just going to be unhealthy all your life and have problems with mood and this and that? Or do you think that this is something solvable? That has a huge impact. Your level of optimism. For older people, it is, do they think that getting old is horrible and not a good time of life, and it's just a time of decay? And I'm sure many of you have parents who are similar to me in age, and you feel that, okay, is this the, and I know getting older is not very exciting, I can tell you. But it doesn't have to be a time of decay, and it's just going to go downwards all the way. No, it can be really wonderful and interesting in many different ways. But yes, it can be different. You may have joint pain and things like that, but that does not mean you cannot enjoy life at that time. So mindset has a huge impact. Of course, rest of the stuff have a huge impact too. So I'm going to share a patient story. So I do teleconsulting for my patients in India. And this is a patient from India. She came to me feeling overwhelmed and desperate. She was diagnosed with PCOS, and PCOS and hypothyroidism are very common in people from India, and they are related because insulin metabolism impacts the thyroid metabolism, impacts the insulin resistance. So she was battling anxiety for more than a year, and her doctor told her that she should start antidepressant medications. Very often this is the route a lot of patients take when they come to meet me. I am never usually the first port of call, but they go to the doctor and they have all these challenges, and the doctor says you need to get on an antidepressant, and then they get in onto internet search, and they come across the fact that functional medicine doctors have a lot of other ways. And I'm not saying always it's natural ways. We have a lot of different modalities. For some people, medications are extremely important, and I'm sure all of you know people who have experienced great benefits from psychiatric medications. But there is a large group of people, this is a problem in psychiatry, where medications have not had any effect, or there are no prescription medications that potentially don't have any side effects. But in psychiatry, some of the medications can also cause problems of weight gain. So anyway, she talked about a 3 p.m. crash. So basically, as a functional medicine doctor, what I would start is with, of course, food. Food is the number one area we focus on. So first they come to me, talk about all these things. I go through the symptom list and what is it that is important for them. Now, let us say this particular woman had a problem of being at a higher body weight. And if that was not the problem she was asking me about, I would not focus on that. Because this is one big problem. Many of my patients have said this. They go to the doctor with something else. Let us say it's anxiety or depression. But what the doctor focuses on is their weight. You lose weight, you will be fine. That is not true. We have to stop dismissing patients and having a conversation on understanding what is important for the patient. Weight loss can come later when she's interested in it. And I have many patients who are so frustrated with weight loss because they've lost weight in the past. You can lose weight on any diet, whether it is the cabbage soup diet, as my friend calls it, or a low calorie diet, or a ketogenic diet, or a low fat diet, or a calorie counting diet, anything. The problem with weight loss is most people can't maintain that weight loss. 80% of people regain most of the weight at the end of 5 years. And that is an area that needs a lot of work. So weight loss is not something she's thinking of at that point. She has other problems that she's thinking of. And if the doctor focuses only on the weight loss, then that doesn't end up being a good consult. So like I said, I'm going to talk about food. So this was her breakfast. The black ones in black were before. Oats cooked in milk with a banana. That when I told her that she was having candy for breakfast, she of course did not like it very much. Oats is all carbohydrates. Cow milk has some carbohydrates. One banana is equal to 6 teaspoonfuls of sugar. So there is no protein in this very little fat. Depends on how where most of the time people use instant oats, which can raise blood glucose levels very, very high without, you won't even know it unless you're wearing a continuous glucose monitor, even if you don't have diabetes. So she changed to breakfast: two eggs scrambled with spinach and tomatoes, cooked in butter, and a cup of black tea, no sugar. Now, had she been vegetarian and eggs were not an option for her, what would I have told her? Either I would have suggested she start with a protein powder, a protein supplement, otherwise, she's not going to get enough proteins, or she could even have paneer. So she could decide which one. Next is lunch was, again, as you can see, most of these are very heavy in carbohydrates: white rice, lentils. So many people think they get a lot of protein from lentils. Not true. Plant proteins are not the best quality because proteins are made from amino acids, and there are certain amino acids our bodies don't have the ability to make. So they are called essential amino acids. And a small vegetable curry, which doesn't have protein, not enough of it, and not enough fat, would depend on what she cooks it in. If it is cooked in seed oils like sunflower oils or any of these highly processed oils, that is not a good oil because it increases inflammation. And chronic inflammation is extremely important for mental health conditions. So that is something you might want to remember. Lunch afterwards, she was, so I told her every meal you have to have protein and good fat. And if possible, have no carbohydrates or very little carbohydrates. So this cauliflower konjac rice mixed with regular rice. Konjac is available in India. I've seen on Amazon last time I was there. So basically, you make blend the cauliflower in one of those blenders, becomes tiny, very small rice-like. But you have to cook the cauliflower very well because it smells quite horrible. And you can mix it with rice if you are, like originally from Eastern India. We grew up eating rice. For us, rice has a lot of emotional connection. So similarly, it might be rotis for you. It depends on what it is. So there are different ways of doing it. If it was roti, you could have besan chilla, moong dal chilla instead of wheat rotis. And I'm not even going into gluten today. Snack, she used to have, this is so common in India. Tea will always come with, biscuits or cookies, as we call them in North America. And why did she eat biscuits? Because this was in the office, and the office by default, the person who served them tea came with the biscuits in the saucer. So I said, okay, you don't need the biscuits at all. Just have the black tea, no sweetener, no sugar, no milk. Are you okay with it? She said, I'm willing to try. Now, if someone is not able to switch from, that thick milk tea, Indian tea with with masala and sugar, and by the way, jaggery and honey are sugar too. They can slowly start with. So one of my patients came up with what I thought was a brilliant idea. She couldn't give up her morning milk tea with sugar. So I said, okay, are you thinking of, at least stopping the sugar? Because she had diabetes. She said, yes, I've been planning to do that. I want to switch to one of the other non-sugar sweeteners like xylitol, erythritol, one of these. And she said, okay, instead of having a bigger cup of tea, I'm going to have a small cup of tea. Yes, we are. I am going to end this soon. So basically, you understand, we are going to, instead of having higher carbohydrate meal, she was having less carbohydrates, more protein and fat. And I asked her to delete her food ordering apps because, as one of my colleagues says, food ordering apps are delivering diabetes, home delivery of diabetes. One of the problems with that is commercially prepared food is made in oil that has a high load of trans fats, and trans fats are the worst possible fats on earth. So she also I also added a bunch of supplements. She was iron deficient. She did not eat any omega-3. Anyway, 1 week later, she was feeling way better. Just in 1 week of changing her food, her mood was stable. She didn't have the crash. This is actually quite a common experience for many of our patients. And of course, food, like I said, is one of the things. And I'm going to end the slideshow and get to your questions. So, artificial sweeteners used in no sugar drinks. I will come to that. Hormonal change due to menopause. How much time do we have? So
I think
someone
we do
asked,
have at least 15-20 minutes.
okay. So should I start with latest research on hormonal harmony? So an anonymous attendee has asked that. First of all, you found that I asked at the beginning, what do you mean by hormonal balance? So similarly, I will ask, what do you mean by hormonal harmony? Are you talking about mostly sex hormones in women in the menopausal transition or in menopause, or is it about younger women and the changes in the menstrual cycle in the perimenopause? So the different depends on which part of your life you're talking about. During the perimenopause or the menopausal transition, that is the 8 to 10 years before menopause. So menopause is 12 months of no cycles. It is permanent cessation of cycles. It is not what happens in PCOS sometimes. A woman doesn't get her cycles for 2, 3 months because she doesn't ovulate. That is not menopause. That is secondary amenorrhea is what we call it. Menopause is permanently the ovary has no is not making any more ova. Nowadays, actually, there are a lot of interesting research going on. I can go down multiple rabbit holes. Maybe a time will come when menopause will become, optional. We are going to use, and this is going to be from a stem cell level. It's not going to be a healthy lifestyle alone, which is going to do that, or just hormone therapy. Hormone therapy is there today. So it depends on what kind of hormonal harmony you're talking about. And estrogen, progesterone, testosterone in women don't work in isolation. It is important to have optimal thyroid function. It is important to maintain insulin carbohydrate metabolism, as I have been talking about throughout this. It is important to manage your stress levels, build stress resilience. Stress levels and cortisol are intimately related. Some mental health conditions like depression, there is very high cortisol levels in those that can itself cause a lot of problems. And so you'd like to understand the effects of hormonal change due to menopause. I am
We
not sure.
actually have one more question about menopause
Yeah,
itself, so I'll just club that. That was sent
both of
anonymously.
them.
It's about remedies to deal with hot flashes during menopause or
Oh,
menopause-induced brain fog and fatigue.
why am I not able to see that question?
It was sent anonymously
Oh, okay. Sorry, you'll have
on
to
in the chat.
natural artificial sweeteners. Let me finish with the artificial sweeteners while I wait for your menopause question. And someone talked
Okay.
about hypothyroidism on the verge of diabetes. What hormone profile is advised? So I'm not providing medical recommendations here. Whatever I talk about is information only. This question about hypothyroidism and diabetes, you need to talk to your doctor. Of course, you need to be tested for thyroid and diabetes and everything. Hormonal profile at the age of 44, very likely if you're from India, you are in perimenopause. In the perimenopause, hormonal profile will not have a huge impact on your treatment outcome, but you do need to manage your carbohydrate insulin metabolism, as I explained. Yeah, so I'm going to that question on are there natural remedies one can take to deal with hot flashes of menopause? How to deal with menopause-induced brain fog and fatigue? Excellent questions. So first of all, when you talk about natural remedies, uh, now unfortunately, a lot of women have been misinformed about hormone therapy. Most women qualify for hormone therapy unless they have an active hormone-dependent cancer, like a breast cancer, recent diagnosis, endometrial cancer, some lung cancers. Those are hormone-dependent cancers. The right hormone therapy, estrogen applied as a cream or a patch on the skin, oral micronized progesterone, that is not progestin, progesterone, which is bioidentical to what our body makes. Both of those are safe hormone therapy. And if you are from India, both of those hormones are available in India, but unfortunately, your doctor may not be educated in them. I am a former OBGY. I can tell you how few OBGYs are really educated on hormone therapy. When I was an OBGY in India, I never prescribed hormone therapy. And now, not only, of course, I can't prescribe for all my patients in India because of multiple different, we don't have patches available in India. I don't know whether you all knew that. And creams also are not available. A gel is available, which doesn't get absorbed very well. So the when it comes to natural remedies, there aren't a whole lot of good, high quality remedies for hot flashes. Hormone therapy is the best treatment for hot flash. Now, when it comes to brain fog and fatigue, it's not only hormones. Your brain fog and fatigue could also be from low iron, low multi-nutrients, and sometimes the perimenopausal, menopausal brain fog goes away. Now, if you're looking at natural remedies because you think that natural is better than hormones, then you are not, I'm sorry to say, it's not true. So natural hormones, like a lot of people talk about soy doesn't do a good job. So the best treatment for hot flashes is hormone therapy if you qualify for it. And if your doctor has not given you the scare, you're going to get cancer and you're going to get heart disease with hormone therapy. Right kind of hormone therapy doesn't increase the risk for those things. Remove the IUD. I'm hoping to learn how to help rebalance my hormones. So when it comes to IUD, that's an intrauterine contraceptive device. Some devices are not for contraception. There are either copper containing or they are what are called LNG. So that is progestin containing, Mirena. Mirena is the commonest one available in worldwide. Mirena is a hormone containing, synthetic progestin containing IUD. So removing that can sometimes cause symptoms, or even having that can cause symptoms. But the copper IUD does not cause hormonal symptoms. Your hormonal symptoms may be as a part of normal life. So depends on what particular hormones. And again, as I have said, there are no ways to balance hormones naturally. Yes, you can get symptom alleviation. So let us say brain fog. And you, during the menopausal transition, particularly insomnia, chronic insomnia, not having the ability to sleep well, is very common. So if you can manage your sleep, and chronic insomnia, the treatment is not sleeping pills. It is something called CBTI, cognitive behavioral therapy for insomnia. That is a guideline recommended therapy. The good thing is there are online CBTI available now. In India, I have not found a CBTI coach yet. So chronic insomnia was my problem. So I got myself trained as a CBTI coach, but I don't do any CBTI coaching. There are a lot of online programs available. And Ananya and Astha, I'm sure you'll incorporate some of the CBTI. This is not the CBT. I know you have CBT information on your website. So they're truthfully natural remedies. And if there is a document, which if you are interested, I know some of you love the knowledge and the data. So the North American Menopause Society, I think in 2023, came up with non-hormonal treatments for menopause. And CBTI was the most important one. And the other one was weight loss. And as you know, weight loss is like, I think it's a several days long webinar. It's not a one-day webinar. Weight loss is, as I said, it's easy. You can lose weight very easily. But once you're older in the menopausal transition or in menopause, it becomes more difficult. But the problem is in maintaining weight loss. And some of the prescription medications, like, for example, there was one for hot flashes, Fizzolintant. I don't know whether it's available in India yet. It is good for people who don't qualify for hormone therapy. So people who have had hormone dependent cancers in the past. And there are some women who don't want to take hormones for various reasons. I have a suspicion many of them are misinformed because their doctors have told them their friend who's a doctor, who's not an endocrinologist, not a gynecologist, has told them, no, you should not take hormones. So any other questions I've missed, or we have done very well for time, I would think. Artificial sweeteners, yes. Let me answer that question because it's very
I
common.
think like a couple of more questions came in.
Oh, okay.
I was wondering why milk was also completely removed from the diet. How does milk or dairy affect hormones?
Okay. So milk, what happens is milk does contain carbohydrates, and I'm talking about the regular cow or the buffalo milk that's available in, I assume, in India. Sometimes those can raise blood glucose levels. If you wear a CGM, a continuous glucose monitor, you'll notice that milk tea, for some of my patients, they were really shocked that milk tea can raise their blood glucose so high. Next comes a problem of, it's not necessarily hormonal condition, but some people have sensitivities, food sensitivities. And dairy can be very inflammatory, particularly for people with mental health conditions. So chronic inflammation is something we want to always bring down, and there are ways to measure it. So milk can be very inflammatory, or even milk products for some people. And this is not lactose intolerance. This is food sensitivity and causing higher inflammation. So the simple way to find out is get rid of the food, the dairy, and gluten is another one, and see how you feel. Or there are tests which are not, like, I don't like my patients spending so much of money on some of those tests because they don't always give us the true picture, but you can get that done. Easier is to stop eating those things for at least 2 weeks, track your symptoms. That is what we in functional medicine call an elimination diet, and see how you do. So, going back to the sweetener question, I am going to answer that. So, when it comes to sweeteners, all these, so number one is stay away from aspartame and all those, the older ones, saccharin. Those are the problem that happened is many people thought if they stop eating table sugar, the white crystals that we are used to, or jaggery or honey, they are sugar too, and switch to which particular sweetener are people talking about? Some of these sweeteners, in studies, they have not shown benefits for weight loss, if weight loss is the goal you're looking at. And some of them disrupt the gut bacteria. So we have these wonderful bugs living in our gut, which help us maintaining our health if they are healthy. If they are not healthy, they can cause a lot of other problems. So these non-sugar sweeteners is what I call them. They have not shown a lot of benefits. They can disrupt gut bacteria, but there are some newer ones like erythritol, xylitol, and these are the new ones which are called wood alcohols. They can look and taste very similar to sugar. So in the ideal world, you would give up all sweeteners, all sugars, all of these. Now, I understand for some people, it is very difficult to give up, that sugar with the tea in the morning. So in my practice, I tell patients to use that as a temporary crutch. Like, it should not be that, okay, I have diabetes and now I have this erythritol, which is supposed to be a safer. There is a newer one called allulose, which has come. I haven't used it yet. It's quite new. That is supposed to work better for people with diabetes. And I don't know whether it's available in India. It's quite new. So instead of having the regular table sugar, you have diabetes, and now you decide you are going to switch to these non-sugar sweeteners, and you're going to have rasgullas and gulab jamuns and everything with that. That may not be a good idea at all. So your goal will be to reduce overall sugar consumption. And I'm not going to go into what happens in the brain, how sugar is behaves like cocaine in the brain, and all the receptors. The other sweeteners can also behave similarly. So there's some very exciting research coming out from where they looked at giving sugar versus giving equal calorie drinks, and the brain and insulin behave very differently. So that was kind of scary. So bottom line is, if you can get rid of all the sweeteners in your world, that is fantastic. Otherwise, use it as a crutch temporarily until your sugar craving goes away. More importantly, if that is such a big problem, it's also important to rule out food addiction. Food addiction is real. And if you don't rule out food addiction, a lot of people are not aware of food addiction, then your food problems will not go away. So check the Yale Food Addiction Questionnaire online, YALE, Yale Food Addiction Questionnaire, and see whether you have a problem with food addiction. And food addiction cannot be treated very easily by, someone who's not trained in addiction medicine. So that's very important to remember too. So did I get all the questions? Is there anything left?
Yes, there's one more question about lack of sleep and how it affects hormonal changes adversely. And then they've also asked
There's
is
one more.
cycle of our periods
Yep.
linked to your sleep cycle, like the menstrual cycle and sleep cycle. Is there a connection there?
Uh, Again, sleep is, of course, extremely important. Now, when it comes to sleep, I look at as three different kinds of problems. One problem, which is more common in younger people, is you don't prioritize sleep. You think, I will sleep the day I die. So that is a different problem which needs different solutions. It needs solutions about setting time aside for sleep, uh, setting enough time aside for sleep, so 7 to 8 hours, and then, of course, not drinking coffee late in the evening because caffeine is going to counter the effects of adenosine and keep you awake. exercising late in the evening sometimes affects sleep, and change your room temperature to about 18 or 19 degrees centigrade. That will bring down your core body temperature. Those things, all the multiple things you read on the internet on how to have a good night's sleep, those will work for people who don't prioritize sleep, like having a fixed wake up time. And but those people who have chronic insomnia, they have problem falling asleep, staying asleep, wake up multiple times at night, which is very common in women in the menopausal transition. 70 to 80% of them have this. That the best solution is CBTI, so cognitive behavioral therapy for insomnia. Then the third group is people with obstructive sleep apnea. Some women with PCOS have that problem. That can only be diagnosed by going to a sleep medicine specialist and getting a sleep study done. That needs different, it needs a CPAP device and all that. So broadly, these are the three different classifications of sleep problems. What was the other question that I missed?
There's another that came in chat anonymously, slightly different, but it's more of a debunking or, is this real question? Lots of
Oh,
Instagram reels suggest that one should try to do certain tasks or activities during different phases of the menstrual cycle
ah,
because you perform more optimally. Is there any truth to this?
okay, good. I think Ananya, you and I talked about it. I was talking about this to another lady. So here is, how things go. So I'll give an analogy of, morning type of person versus evening type of person. That is the morning chronotype versus evening chronotype. As you know, there are some of us, I am a morning person. My son and husband are evening. Like waking up in the morning and going for work is very hard for my son. So, yes, you can counter the effects of your chronotype and manage to do that. Now, when it comes to the menstrual cycle, let us say you are supposed to be more creative in the, I don't know, which part of the cycle are you supposed to be more creative? So let us say you're supposed to be more creative in the first half of the cycle, and you share your menstrual calendar with your entire team, and they know you are less creative at that time. Now, I don't, so when you ask me, is there any truth to that? I don't think science has shown us much. But what I completely disagree with is that should not be another reason to, to be judgmental against women. She is not in her creative phase of the cycle. Let us not include her in the team meeting. you know? But because the reason why I'm saying that is we are humans, we are capable of overcoming a lot of our challenges. I am sure most of you have done this. You slept just 3 hours at night, and next day you went and appeared for an exam and did well. I have done this too. Like I didn't get good sleep the previous night. I slept for 3 hours. Next morning, I had a webinar and I managed fine. So I'm not saying that that does not exist, but should you manage your work calendar to that? I don't think it'll always be practical. Like I was telling a lady, I said, okay, then in that case, I'm only going to hire menopausal women on hormone therapy. Then I don't have to worry about their cycles. I know it sounds horrible and terribly judgmental. That is not what it should be. But again, we can wait and see if something, but I believe in human beings' ability to overcome a whole lot more challenges. Our
Yeah.
habits overcome a lot of things.
I think there's some like people that advise different workouts depending on which phase of the
Yeah.
cycle you're in. So maybe that is more practical, but your work calendar and like that is quite impractical, I think, to schedule as
Yeah.
per
So
your
in terms
menstrual
of
cycle.
physical fitness also, it's like, should you eat carbohydrates? Should you, exercise in the fasted state? Find out what works well for you. If you find that syncing your menstrual calendar with your work calendar is working for you, go ahead and do it. If you find it's not working for you, then don't do that. These are like what we call N of one tests. So, and sample size of one person. And self experimentation is very important. No one can tell you this is the best possible way for you. And, that is the only way. If someone says that, stay away.
I think we'll start winding up. We do have one last question that remained unanswered. Does sleeping in parts but completing 8 hours of sleep have an impact?
Okay, so first question to ask yourself would be, do you feel rested in the morning? And if you feel rested, so sleep quality and quantity, both are important. Now, some people, particularly women with chronic insomnia, when they are going through the CBTI therapy, there is something we call this is like what we do is, let us say the woman wakes up. This is I forget, term is missing out. Stimulus control. Sorry, got it. So stimulus control is you wake up in the middle of the night, and if you have insomnia, you will know whether you're going to fall back asleep or you're going to stay awake. At that point, don't stay in bed so that the brain doesn't associate wakefulness with bed. Get out of the bed, do something that is not, don't watch the news at that time. Do something that doesn't get your brain racing, maybe reading fiction or something that doesn't get you all worked up, or doing some hobby or something like that. At that point, when you are like actually feeling sleepy like this, you go back to bed. So such a person may get 8 hours over longer time and fall asleep and go back and all that. But at the end of the day, in the morning, do you feel rested? That is very important. And of course, it's important to rule out if there are any problems like obstructive sleep apnea. Women don't always have snoring and, not breathing when they're sleeping. They have other symptoms. Some women may have anxiety, panic attacks, early morning headaches, hallucinations, and then a sleep study has to be done to confirm it. So that is yes and no, the answer. Okay.
Okay.
Anyone wants to share anything that was like a major takeaway? If you, and those of you who want to leave, please feel free, because we're 8 minutes past the time we said we would be. And I just want to share one thing in case any of you are interested. My area of focus is brain health, as all of you probably know, and I'm specifically interested in better management of hypertension. And in case you want to know a little bit more about mental health and what are the other things that you need to focus on, I have a free ebook. So this, I have shared the link, and I
I
think,
think
oh,
this went to just us, the host and panelists. So we can send out this link.
yeah,
Um,
sure. And actually, I think my last slide had a QR code as well. So
yes, you can
I
share
can
that
share
slide.
that. Yeah. So for those of you who are not going to get the chat, if you're watching it later, you can scan this QR code and download this ebook. And I'm available through my website in case you want to reach out to me. Okay, so I'm going to leave that
And
there.
yeah, um,
Oh, thank
I
you
would
very much.
love if people can,
Thank
yeah,
you. Thank you for your
sign the QR
support.
code and keep in touch with Dr. Carr. And we'll also share our QR code for you to stay updated on any like the upcoming webinars and our website. So I'm screen sharing that and leaving that up here for people. We did have a very nice message in the Q&A chat about someone who basically just joined for information, and then they said, Dr. Carr, can you see this message? I joined the session purely for knowledge, as I currently have no health issues or concerns to address at this stage of my life. However, I'm now realizing the potential harm I might be causing myself as a lover of milk tea. I enjoy foods like curry rice, dosa, idli, and poha. And previously, I only considered chocolate harmful in my diet and tea harmful due to its caffeine content. When I checked my blood sugar levels during college, they were significantly below the diabetic threshold. But since completing college and continuing my studies from home, my sugar levels have risen to a point where they are now just slightly below the diabetic range.
Mm-hmm. So good, you came for information and you ended up getting knowledge, actually. That is wonderful. And I do hope you can take some actions. Caffeine is such a misunderstood molecule. Maybe we'll have another separate discussion on caffeine. I covered caffeine on my emails fairly recently. Caffeine may not be the problem that many people think it is. If you love caffeine, continue enjoying it. It may not be a problem for you. But yeah, carbohydrates and protein and fat intake, managing all of that is very important. And it's hard, and particularly for people who are vegetarians in India, it is not easy to eat more protein and not in a lot of carbs along with that, because most of the carbohydrate containing food that people in India eat have a lot of carbohydrates in them. And each person's personal threshold is different. So, okay. So bye everybody. That was wonderful. And we are 12 minutes over. And thank you so much, all of you who still invested the extra time with us. It's wonderful. And wishing you all the best. So I'll end the webinar and I assume they're going to receive a copy of the recording, the replay as well, right? Okay.
Yes, we
Bye
can.
now.
We'll send over a copy of the
Yeah.
recording.
Bye now. Take care.